Hello everyone, welcome to sqadia.com. I'm Hina Khan and today the topic of our lecture is sudden deaths in infancy. Now it's also known as sudden unexpected deaths in infancy, and that's why it's known as SUDI, or it is abbreviated as SIDS, that is SIDS or SUDS. So these are the abbreviations that are commonly used by the medical practitioners for such deaths that are classified. And infancy is basically, as you all know, it's basically an age limit under 1 year of age. That's basically the time period which is known as an infancy period. So any deaths which have unexplained causes, even after a detailed autopsy and even after a complete investigation of the crime scene, they are classified as the SIDS or they are classified as the SUDS. So in the first section, we'll be discussing the definition, and the complete definition will be discussed over here along with the other terminologies used for such a condition. And then we'll be discussing the causes which relate to the sudden deaths in infancy. Moving on, we'll be discussing the criteria for the San Diego definitions, which were put forward for a complete recognition of this condition because it's quite debilitating for the relatives as well as the parents. And the condition is quite an unexplained condition. So they gave their criteria, the San Diego, they gave their criteria over there, and we'll be discussing the criteria in detail over here. In the second section, we'll be discussing the risk factors that basically predispose an individual or an infant for such a death. So the age and gender is one of them. Twinning is also a phenomena which predisposes the infants for such sudden infant death syndromes. And then the seasonal incidence is also an important risk factor. Social class and the housing of the infant, that is discussed in detail over here in this second section. Moving on, we'll be discussing the external and the laboratory findings of such deaths, the case history and the death scene investigation. Obviously, it's very important, and the histological findings, they're all going to be discussed over here in this third section. The causation theories are again very important over here. They are put forward by different scientists, by different researchers, and it's an ongoing process, of course. In the fourth section, we'll be discussing the SIDS autopsy in detail over here. The autopsy appearances are also discussed over here, because they vary from one case to the other. So they are discussed in detail over here in this fourth section. Now in the final and the fifth section, obviously it's the crux of the whole lecture, the medicolegal problems, because as a forensic medical practitioner, it's very important that you know the medicolegal aspects for a certain death, and we'll be discussing the medicolegal aspects for the caught deaths. We'll be differentiating SIDS from external suffocations. So external suffocations have their own particular characteristics, and we'll be discussing the differences between the two of them. Multiple sudden infant deaths, why are they caused and why is the number increasing? There are different causes for that, so we'll be discussing that as well. Counseling of the parents is an ethical issue, and sometimes when you perform an autopsy on such an infant, the person who performed the autopsy will not counsel the parents, but it is very important, and it's an ethical duty of the doctor, whosoever performed the autopsy, to counsel the parents and to give a complete picture to the parents as well. So I hope you want to learn more about these sudden deaths in infancy. So do watch the other sections of this lecture as well.